All right.
And maybe you are one of those families who has adopted from ACS or another shelter here in town. You have many responsibilities ahead of you, like keeping up with your pet's health, and often their dental hygiene is put on the back burner, but really it should be a priority.
That's right. Here's Alana with more from Texas Veterinary Hospitals.
Well, you guys know how important it is to keep up with your pet, especially their health. But today we're learning how important it is to keep up with their maybe pearly whites, maybe not so much. We're talking to Dr. Mixon from Texas Veterinary Hospitals. Thanks for having me out.
Thank you for being here again.
Okay, well, I know our dogs typically don't have the same teeth as we do. They're probably not that white, but it's very important that we're keeping up with them because it could lead to something that's maybe a little more serious.
That's exactly right, because what we see is 70 to 80% of our pets over the age of 2 have dental disease of some form.
Oh.
And so from our standpoint, it's the most, dogs have this problem more than any other problem, yet we actually treat it the least because most people don't think their dog's teeth are as important as everything else because it's kind of out of sight, out of mind.
Totally.
And dogs are so much tougher than we are. So if they have a bad tooth, they're not going to cry and whine like we do. And so if you had a bad tooth, well, you'd be at the dentist the next day crying and having to get it fixed. Poor dogs, no. And so they can get draining tracts in their mouth, the teeth are loose.
You never even know.
Yeah, and we see all kind of horrible, disgusting dental disease and infections in their mouth, and people have no clue. And these are also the same mouths that are licking them. And so, hey, Fifi, how you doing? And a big old lick on the mouth, and she's got all kind of nasty stuff going on in there. And so it really brings home the importance of, hey, maybe that mouth should be a little bit cleaner, a little bit cleaner. And so it's very important. And it's just simple, just evaluating the basics, just lift the lips and take a look.
Okay, well, that's my next question is, what's the first step we should do? Obviously, take a look.
Take a look. That's your first clue. Your nose can also be a good sensor, because if you're smelling horrible breath, because dogs don't have the best breath anyway, but it can get worse. And so if it smells like a garbage can or something died in there, usually that's a sign that there's even worse infection going on. Okay. And we see that, we smell that a lot actually. Yes, so sight and smell. Okay. The other thing is bring them in for evaluation so we can take a look at them, and if we need to do dental x-rays or things like that, we're capable of doing that, because many times they have lesions that are above the gum line that you just can't see with your eyes.
Oh boy, and I know very common gingivitis.
Yes.
That's something that we need to look out for. Other than looking, what other signs should we look for to see if they have gingivitis? Gingivitis,
well, gingivitis is just simply looking at it because you'll see the gums just really red and inflamed. And sometimes what you'll see also is uneven redness. So say on one side of the mouth there's lots of tartar and inflammation, but the other side looks normal. And usually that can be a sign of pain. So if their mouth hurts on one side, they're not going to chew, so they chew with the other side. So the other side looks great, but the other side looks horrible because it hurts. And the tartar accumulates faster, so because they're not using the teeth, and the tartar just builds faster and faster. But then you'll see more gingivitis, and you'll see whatever tartar accumulation going on there.
Well, I know behind us, you guys can't see right now, but there's actually 2 pups that just had some dental work done. About how long does it take to come in, have the work done, and then your pup back to normal, waggling their tail?
Well, usually we drop them off in the morning, and they pick up in the afternoon. And the actual procedure, anywhere from like 30 minutes to about an hour, depending on what we're doing. Yes, and so. We do have to give them a little sedation because they're not going to allow us to get in there and do all the things we need to do just because they have teeth and they want to use them sometimes, especially because sometimes it's a little bit painful scraping above the gum lines, and if you hit a bad sore spot, they're not going to be as kind.
Hey, I feel like they are like humans in that we'd rather be sedated and just get all the work done when we wake up, and then you're brand new.
Exactly.
Okay, well, it hurts me a little bit to think that our pets are toughing through the potential pain that we don't even know about. So to avoid that, I suggest bringing them in, coming to see Dr. Mixon at one of their many locations, 3 locations in town. Thank you for talking with me.
Thank you for being here.
And for more information on Texas Veterinary Hospitals, there are the locations right there on your screen. You can log onto their website, texasveterinaryhospitals.com.
All right. And we also have a special offer for you for free new patient exams, a $50 value. So there you go. It's free. New patient exams.
Nice.
Take your pets. You have nothing to lose.
Good job. Thank you, Alana. And